Cindy Hellman Wiley. I'm a nurse practitioner, and my pronouns are she and they. Home right now is Vallejo, which I've lived in for probably 30 years. It's where I moved to when I moved from Missouri here. Pursuing school was interesting. I have an undergraduate degree in electrical engineering, then decided that maybe I would do something else. Went to nursing school. I had actually wanted to do bioengineering and felt I needed to learn more about healthcare systems in order to do that. Liked nursing, moved out here, worked in various places, oncology, ICU, ER, decided to go back for a master's degree to become a nurse practitioner. Worked night shift, 10-hour night shifts while I was going to school. My kids thought I was crazy, but I made it through and have been worked for the county as a nurse practitioner in a few different settings. Worked in my first job here was on the inpatient psych unit, doing the H&Ps and medical care for the psych patients. Then public health, where I did women's health, the homeless van, homeless family practice, did some prenatal, then got the opportunity to get back into oncology, which is my first love. So for the last 13 or so years, I've worked as a nurse practitioner, the only nurse practitioner in our hematology oncology clinics here in the county. And my experience that influenced what I'm doing now, I don't regret having other degrees. I think learning is wonderful, and you can always bring something from whatever degree or whatever classes you have taken. I was really drawn to oncology because I've wanted to help people. My first job out of nursing school as an RN was in a state cancer hospital, where I learned that for many people, cancer is a chronic illness. You don't just get a diagnosis of cancer and drop dead in a week for most people. That really appeals to me. I wanted to broaden my horizons, got into ICU, ER, other fields, and I feel they've all brought something useful.
All right, thank you, Cindy. Would anyone else like to share?
I can go next. My name's Fatuma Saho. I am originally from Albuquerque, New Mexico. That's where I was born, raised, and did all of my schooling before moving out to California. I was living in Vallejo up until about 3 weeks ago when I moved to Martinez so I could be closer to the hospital. Going back to my pronouns are she, her. And so my journey into medicine, I guess started when I was like younger. I was always fascinated by it, the healthcare system. I learned, I think it was like a neonatal, like like a neonatal intensive care doctor, and I just like saying it. So I decided that that's what I wanted to be because it was fun to say. And it sounded smart, so it's like that's what I want to do. But then I went into then my sister got sick. She was diagnosed with type 1 diabetes, and we didn't really know what it was at the time. She went into a coma and she almost passed away, and for me that was like really kind of awakening, just like not knowing all of the medical jargon that they were saying, her having to all of a sudden stick her finger so many times a day. And so I thought I wanted to go into medicine. So when I went to college, I was planning on going to med school. I majored in sociology though, because I was really fascinated by just people and how people behave, and how people behave in groups particularly. And after college, I wasn't so sure if I wanted to do medicine as a career anymore, just because for me, I didn't really have any like mentors in medicine. So I didn't really know what that would look like for me or what it entailed. And I thought it'd be really difficult just to like find someone with all the steps that were required, like the shadowing. And I was like, I don't know, I don't know if it's gonna work out. But I still wanted to do other things in healthcare. I looked into going into nursing school, but that meant going back to school because there's like not the same requirements. And my sister was a nurse, and I said, I don't know if I really want to do that. So I was working as a phlebotomist for a while I tried to figure out what I wanted to do after I graduated from college. And then my little brother came back from Africa, and my siblings called me and they said, I don't know, he's been really sick. He's like, we're testing his blood sugars and they're really high, or it says high, it just says high. And he's not really wanting to eat and he's peeing a lot. And it's like, well, this sounds exactly like when our sister was diagnosed. And like, yeah, well, we don't know if we should take him to the hospital or not. And I was like, no, we definitely should. I mean, it's like we should do something. And I don't know if it's because I was the oldest and like they don't remember how sick my other sister was, and I remember how sick she got. So they took him to the emergency room, and I like told them, I said, you know, I think it's diabetes. This sounds very similar to what my sister had. And they listened and they tested his blood sugar. It was like 700. Um, diagnosed with diabetes. And I think for me, just like realizing like having like that little medical knowledge that I had, being able to help my family member, like then go, if I like went into medicine, I would have more and would be able to help more people than just like my family member. And so that's kind of why I decided to go into medicine. And I chose family medicine because I really liked the idea of being able to do preventative medicine and not just seeing people like down the line, but hopefully helping them from ever needing to see like a specialist down the line. So that's a little bit about me.
All right, thank you for sharing that, Fatuma. Sylvia or Anna?
I can go. Hi guys, I'm Anna, Anna Boulos. My preferred pronouns are she, her, hers. I grew up in Salt Lake City, Utah. I'm similar to Fatuma, where I was born and raised there. And I did all of my training there, like my undergraduate and medical school there. And I'm also similar to Fatuma in the sense that my interest in like healthcare and things like that was very personal. My father passed away of heart disease when I was very young, and I always thought I wanted to be a nurse. And I did some like nursing classes and things like that in my undergraduate degree, but then ended up going into biology to eventually go into medicine. Yeah, so I think biology was kind of the easiest thing to study to go to medical school, but I know that when I took a couple of years off to like apply for medical school and take the MCAT and everything, I also studied global health and like in the public health department. And I just loved my like research that was abroad, and I liked thinking about the public health sector of medicine rather than biology, which was so like the fundamentals of medicine. So it like brought in a different perspective before I went to medical school. And I definitely thought I was going to leave Utah for medical school. That's why I saved money to apply to lots of different medical schools. But I stayed in Utah, and I loved the training there. I think it's a great medical school. It's just not a very diverse place. Utah has it's beautiful there, but it was less than like 40% of my class were women, and like very few people of color. And I had a few interactions with my classmates where I was treated like I didn't deserve to be there. I was kind of like a diversity pick, and it was really frustrating to have my accomplishments treated like I was like they were belittled because of being a person of not a privileged background. So although Utah was great for a lot of reasons, I remember when I was applying for residency, I knew I wanted to leave and I really wanted to work with like more of an underserved population, and I wanted to be in a more diverse place. And so the Bay Area was great in the sense that you guys, it's beautiful here and there's just a lot of diversity and there's just a lot of people with a lot of backgrounds. And I felt like being a generalist here in like a safety net system, I was like a family medicine doctor. I could work with people that had like socially complex backgrounds, but also like health conditions that were complex. And so I just really empathize with those kind of people that that needed more help with more things rather than some of my classmates that went into very different professions in medicine. So I feel like my background and my like a lot of things that I was raised in really brought me to where I am in medicine now.
Oh, thank you, Anna. So Sylvia?
My name is Sylvia Fonseca. I am originally from Lima, Peru. I moved to the US with my family when I was 7 years old. Let's see, I'm the first in my family to go to college. And I became interested in medicine, I would say at a young age, like middle school-ish. And that was also from personal experiences. When I was I think I was like 12 or 13, I was diagnosed with bladis retinal degeneration. And basically my vision was declining rather quickly, and it was something that if it hadn't been detected soon enough, I could have had a retinal detachment, which would have led to permanent vision loss. And this was something that was detected by my optometrist during just a regular eye exam. So that was really impactful for me at a young age and kind of interested me in medicine. So then I went into college already with that idea that I wanted to become a doctor. I went to UC San Diego for undergraduate, and then there, I kind of like Fatuma said, kind of meeting a lot of the other students who were on that pre-med track. It kind of, I remember feeling like I didn't quite fit in with them. Like the classes were so big, it was, you know, really impersonal. Like the biology classes were like 500 people like in it. So it was hard to make like close friends in those classes. And yeah, I just didn't really feel like I connected with a lot of the other students there. And it wasn't until I joined student organizations like the Chicanos for Community Medicine, where I met other students like with similar backgrounds as my own, that that helped put me in touch with other health professionals that were also people of color that had similar backgrounds. And then I guess I went back and forth during my undergrad in terms of deciding whether I wanted to actually go into medical school or did I want to do research, etc. So by the time I figured out that I did want to go into medicine, I was already like on my 4th year of undergrad. I hadn't done a lot of the things that you need to do, like shadowing experiences, like clinical experiences that people recommend before applying to medical school. So I ended up taking a couple of years off. So during that time, I worked on my application. I also worked as a production chemist for this this company that makes chemical products. So a lot of the, like when you get a pap smear, for example, the little vials that they put the sample in, like we would produce that stuff, or like stains that you use for like microscope slides and things like that. So I did that for a couple of years, and then I started medical school at UC San Diego. And let's see, at UC San Diego, I was also part of the PRIME program, which stands for Program in Medical Education. And that's a dual degree program where it's for students who are interested in working in underserved areas once they graduate from medical school. And during this program, you do a master's degree wherever you'd like in whatever concentration. So I ended up doing a master's in public health. I went to Harvard for a year for that, and then I came back. And then now I'm at Contra Costa for my family medicine residency. And the reason I decided to go into family medicine was I really like the idea of being able to meet patients at different stages of their lives, being able to meet the relatives, take care of mom during the pregnancy, and take care of mom and baby, and then, you know, see them later on, meet the siblings, take care of grandma. Like all of those interactions were really interesting to me. And also like Fatuma was saying, knowing that you can prevent a lot of these complicated illnesses just like with regular preventive visits was also a really big draw for me. And I realized I forgot to say my pronouns earlier. They are she and hers. Okay, thanks.
All right, thank you so much, Sylvia. I think you summarized it perfectly. So actually everybody on this panel today is within family medicine, either practicing as a doctor or as a nurse practitioner. So if that helps clarify any of the questions that are coming in, everybody is practicing in family medicine. So one of the first questions that we got from folks, and I'm just going to summarize Amanda's question. So in your academic and professional journeys, what advice do you wish you had received, and what advice would you give for someone who is currently trying to pursue your job or field?
I think advice that I wish I had received personally was that even though at times it may seem like you're in over your head and you made the wrong decision, if you really feel truly passionate about it, then you're doing the right thing, and just to keep working on it. I think that it was just not knowing a lot of doctors personally. It was sometimes like, am I like the only one who feels this way, like, and is having a hard time? And realizing that no, later on, I'm not the only one feeling this way. Other people are having a hard time. And once I realized that, I think what advice I would say is, if you're struggling in anything, like I think in college physics was really hard for me. And I just couldn't get it. I mean, I understood the equations, but it was really difficult. But I recognizing that, and then going to, they offered tutoring, going to that all the time and being like, please explain this to me, please. And then they'd explain it, and I'm like, okay, well now tell me again, because I still don't understand. And you realizing that there are a lot of resources out there, and that even though you may not know them personally, it's okay to ask other people and try to find the resources that help you. So I think that's what advice I'd give to you.
I would echo some of Fatuma's ideas in the sense that, like, definitely find tutors and people that can help with those, like the nitty gritty of academics. But I wish sometimes I found mentors earlier on, some people that could give me perspective. Because like the first thing she was saying, how it seems like really daunting and really difficult, like it's going to be a long process. I think sometimes people's perspective of, yeah, it's a long process, but I enjoyed the journey is really helpful. And it's nice to have someone that like that gives you perspective and like encouragement that you can do it and things like that. And also advice of how they navigated that same system. So I love all my mentors.
I agree. I think one of the most important things is speaking with different people and getting different perspectives from people. Like some people will really like sugarcoat the experience and it's like, oh yeah, it's not that bad, blah, blah, blah. But there's also like people that are very negative about it. So it's just good to get different perspectives and hear yeah, get everybody's opinion on, or at least like what their experiences were. And it's very helpful to just, yeah, learn about like speaking with different health professionals, knowing that like medicine isn't the only way to get involved, to be involved in healthcare. There's plenty of other professions, and speaking with people in those professions and seeing, yeah, what their day-to-day is like. And also really good for networking and being able to, possibly set up like shadowing experiences with them. Yeah, I think those are really valuable.
I have to agree that networking is something that I wish people had encouraged me doing more of, because you need the support, and we tend to be really, really hard on ourselves and want to be perfect and are upset when we can't be perfect because we're only human. So it's really good to have a group, a network that you can bounce ideas off of and get some feedback, and basically someone that can tell you, you're okay, you're doing fine.
All right, thank you all. Those are beautiful reminders, advice for all of us to recognize and realize that we're not alone in this journey in the health field or pursuing the health field. So definitely connect with other people. And I'm really glad that all of y'all have joined us today to connect with each other, right? So the next question that we have is from Patience. So throughout your journey, how did you separate work and school from social life? So what does work-life balance look for all of y'all currently? And then I also want to include, how do you also manage your emotional well-being and mental health with your jobs as well? So if y'all need me to repeat that, let me know. But yeah, so what does work-life balance look like for y'all? And what does mental health look like in your life right now? Like managing that.
It's really important to have some kind of a physical outlet to to get away from things and help you de-stress and recuperate. I know it's hard when we're busy to get some form of time to do that. My personal thing is I do karate. That's my stress relief. Good exercise, self-defense, those kinds of things. Other people might meditate, they might take walks in the forest. Those are all great things, but please give yourself permission to do those.
I was gonna say, I think I saw Anna and Fatuma and I kind of smiling at this question because I think it's hard to, really be strict about like work-life balance during residency when you're expected to be like, it's, the time that you're training. But I think like that's a really important question, and I think it's doable, to try to have a balanced life as much as possible. For me, I think, yeah, one way I set a clear boundary was like, I didn't want to live in the same city like where the hospital is. Like a lot of my co-residents like live in Martinez because it's really close, or really convenient, you get to the hospital quickly. But for me, I was like, well, I want to have a clear boundary where I'm able to separate work from home and personal life. As much as I love my co-residents and my attendings, I don't need to be seeing them at the grocery store all the time or whatever. And other things that are really important for me personally are just having really supportive people in your life. So, and knowing who you can turn to, to vent when you're having a bad day, or to bounce ideas off of, or who to go for advice. So for example, I'm very fortunate. I was able to meet really good friends in medical school, and we've become lifelong friends. And, we check in every so often. We try to get together whenever we are available. And so that friend group is a really good source of support. I also call my family regularly. They're in Los Angeles. So for me, that's also really important to stay in touch with them. And then I don't know, I'm not the most like athletic, active person. I like to go out for walks like in the evening. But yeah, that's what I like to do for self-care.
I think, yeah, work-life balance, I think, is an interesting thing right now because, like Sylvia said, we're in residency, so it's not. I mean, right now mostly we're here to work, and then maybe later on have a life. But like during college, I had a lot of work-life balance. Where I think at one point in college, I was working 3 jobs because I was bored. I wanted more money. To support my shoe and shopping addiction. So I think that you can have a work-life balance then. And then I think in med school as well, I mean, I had a pretty good work-life balance. I think for me, what made it a little bit harder is just moving out here and not knowing as many people out here besides like the people I work with. Has made it a little more challenging, but I have like a really good group of core friends that I've been friends with for over 10 years, that we talk a lot. We try to do like a yearly trip. Like this year, they knew I couldn't really go anywhere, so they flew out here and we did something together. I have I told you about 2 siblings, but I'm the oldest of 6. So I talk to my family a lot on the phone, and 2 little nieces, and even though I'm not with them like physically, I think just talking to them really is helpful for me. Things that I do to kind of unstress and de-wind is I listen to podcasts, especially podcasts about murder, which sounds kind of odd, but I like listening to my murder podcast, and that helps me de-stress a lot. And then I meditate, and so if I'm feeling very stressed out, meditation really helps me out a lot. I'm not very athletic, and I think I've gone on 2 hikes now since I've been out here in California. The first one, I'm just afraid of nature, and there were coyotes the first time, so that like dissuaded me from wanting to go again, but they convinced me again yesterday and it was fine. So I think you really just have to prioritize what's important in your life and realize that sometimes things can wait while you take care of your mind.
Yeah, I think the way I take care of my mental health is really similar. I do enjoy hiking. I am more outdoorsy. But I didn't just see I saw 2 bear. I saw a mama bear with baby bears this weekend in Tahoe. Recently, when I went to Big Sur, I crossed paths with a cougar. So I don't think I should continue hiking. Like it sounds like I'm gonna get in danger doing this. But I really enjoy I enjoy activity, getting outside. And I just recently got a puppy, so I've been going out for lots of walks and getting outside even more. And I have I have a partner here that's really supportive. I'm really close to my family. My siblings live all over, but we still make ways to see each other often. And then I live in Martinez and everything, and I love our group of residents. I think as much as it's nice to have time to yourself to reflect on how busy medicine is, it's also really great to have your co-residents that are going through the same process, and you just vent to them because there's just no one like your co-residents who understand what you're going through. My partner, as much as he wants to be very supportive, he has no idea what I'm doing. And there's nothing like talking to Fatuma about my day. And we do a lot of crazy things, and we see a lot of crazy things in our career. So it's really nice to have someone that understands that process more than anyone. So yeah, I love my co-residents. And I think that's a big part of mental health in medicine for sure.
All right, thank you all for sharing. So the next question is from Vanessa. What do you like most and least about this field and/or your careers?
What I like most about this is the connections I make with people, with patients and their families, and knowing that I'm helping them. Meeting them where they are, negotiating ways to help them be healthy, and being a support for them. the thing I like the least is paperwork and really the sort of overwhelmed sense that you can get with clinics. There's more and more pressures for us to see more and more patients. And I really get stressed when I feel I can't spend the amount of time I think they need. So I end up giving them the time, but end up having to do charting later. So that's kind of a real major problem as far as I'm concerned.
I also agree that I think the relationships you make with patients is amazing. It's very, you work with patients in a very intimate setting. You know, the first time you meet them in clinic, you ask them about like all of their personal life, or you're delivering their baby, and it's like such a important experience in their life. But even the one time they're in the hospital for pneumonia, like they'll remember that experience forever, you know? So there's just, it's very important. And it's like an honor to be a part of that for so many people. But the thing I probably hate the most is sometimes just the pressure of being so good at stuff for so many hours. Like it's a lot of work, and then there's been times where I've worked 100 hours in a week, and that's just a lot of hours just to still be at my best. I don't know how to do 24-hour shifts and be at my best. It's a lot of work sometimes.
Yeah, I agree. I think the personal connections that you make meeting patients and their families are the aspect that's most rewarding for me. I want to say, especially like, you know, being from Latino background, meeting patients who only speak Spanish, you know, and then they see you, you're their doctor. They're like, wow, she speaks Spanish. She has a similar background as me. She understands what I'm going through, and just kind of seeing the relief on their face that somebody is there to be able to, who has that shared language, who can explain, you know, some of the, like their illnesses or the medications that they're supposed to be taking that maybe they didn't understand previously, you know, just because with the translator, things can get lost in translation, things like that. So yeah, I would definitely say that's been one of the most rewarding aspects. The other thing too, like there's, it's so nice, like when you're seeing somebody in clinic, for example, and they're there with like their kids, and then the kids have a different doctor as their main doctor, and then they ask you, oh, actually, could you be the doctor for my kids, or for like this other person in my family? Like that's always such a nice experience. And yeah, in terms of like the most like challenging parts of the job are, I agree, like the documentation and the pressure to see so many patients, do a thorough job, and do it like in a timely fashion. Like it's really, really difficult. And I end up with the same problem as Cindy mentioned, that I maximize all of my time in clinic with seeing the patients, so then I end up having to spend the additional time at the end, like just finishing up the documentation or other care coordination things later.
I agree with everything that everyone else has said. Like that's my favorite part of the job, is the people, talking to the patients, especially, when I see patients who look like me. When they see my name, they say they always imagine someone different than who is presented in front of them, and they're like, oh, you're a Black doctor, and they get really excited, especially if they're like a Black person as well, and they're excited to have a Black doctor. And like, oh, I've only ever had like no Black doctors in my life, and I'm like, well, I'm your doctor, and that makes me really happy that I can be there for them and provide a service. And people tell you really personal things that I don't know if I've told my doctor those kind of like like when people tell you like really intimate details about their lives, and it's an honor that they do tell you that, and it really is a privilege that they trust you enough to tell you those things and want you to be a part of their life. in that way. And being by someone's bedside when they like give birth to their baby and being like, oh, well, you're a parent now. And on the other end of it, telling, you know, a loved one that their person has passed, and, you know, providing comfort to them, you really do see like the whole spectrum of it in this field, which is amazing. I think my least favorite, like, I don't like the documentation, but my really least favorite part of it is like the things that I feel like I can't control, like when I can't get a patient a certain medication because of the insurance. They don't have the exact right insurance, and so I have to like try and change it when I really feel like this med would be better for them. Or if I order something and they went to go pick it up and they couldn't get it because it wasn't like the right insurance. And so I think that's where I feel the most frustrated, where I feel like because of that, I can't do, I end up providing like a disservice to my patient population sometimes, or because of, you know, they aren't sick enough yet for me to actually get them to somewhere where I think they need to go. So that's my least favorite part of it.
All right, thank you all for sharing, you know, the realities of the healthcare system and your experiences. So I've noticed that Marcia is no longer in the video chat anymore, but I want to make sure that we get it answered for them, and that we'll send this video over to them afterwards. So if anybody has any insight on this is what Marcia had to say. So my goal is to become a public health nurse practitioner. As a returning student, I feel that I have to complete or I have to compete with younger applicants and overlooked because of my age. What would you recommend for someone like me?
So I understand very much how that feels. When I went to nursing school when I was 30, I went to my nurse practitioner program when I was 46. So I've always been an older student. A lot of stand up for yourself. Let people know what your qualities are. And an older student can bring a lot of life experience that's going to be very, very helpful to whatever career they choose. And I think it's really important to play that up. Let people know what you're capable of, and that, you know, just because you're older doesn't mean that you don't have value.
I can't probably empathize as much. Like I only took a couple of years off, but I felt like taking perspective of time like away from like a classic education was really helpful for me. And I think a lot of my co-residents were similar, that we like having extra experience outside of an academic career is not necessarily a downfall. I know it's probably intimidating to come back to training, but it's not. I've met a lot of great people that did that. I just don't empathize as well as with those people.
Okay, I hear you. So thank you, Cindy and Anna. So there are only 15 minutes left, so I'm gonna chunk up the next two questions together. So Amanda and Patience are asking if y'all have any suggestions on professional associations that they can join. And mind you, this is coming from high school students or people who are not currently in medical school, nursing school. And then the other question is asking if any of you have tips or recommendations on applying for scholarships or budgeting during college. So professional associations, and if you have any tips for scholarships and budgeting for being able to afford going to medical or nursing school and college undergrad.
So for professional organizations, it depends on what you want, what your goal is. If you know that you want to go into, say, nursing, there are organizations that you can often join as a student for a discounted rate. If you have a particular interest, I've done some internet searches or through networking found different professional organizations to join.
not be like, I'm not from the Bay Area, but I know that there's similar experiences here. When I was like applying to medical school, I really appreciated, or even during my undergraduate degree, I really enjoyed my time volunteering at like the children's hospital and things like that, or volunteering at a free clinic where it was very similar to family medicine, where it was general work, but there was a lot of specialists there. So I felt like there was a lot of ways to volunteer and get exposed to things. I know that that's probably not an easy thing to do right now with the coronavirus, but I just remember it was another time where volunteering was kind of that networking, finding mentors, like I talked about before. I thought that was a great experience for me.
I don't know of any, like I can't think of off the top of my head of professional associations like during like undergrad. I mean, I think during medical school, I joined the Latino Medical Student Association. So they have, so that is for, well, you can join it as an undergraduate. They have some opportunities, and then you can be part of it too during medical school. And they have like mentoring opportunities. They have also like conferences every year, and that are also regional conferences that you can go to and meet other students and be able to network. In terms of scholarships, I definitely encourage all of you to apply to as many scholarships as possible. During high school, there was a period where I was applying to like 3 to 4 different scholarships like a week, just because I was so nervous about not like my family, you know, we didn't have a college fund. Like there wasn't going to be a way for me to finance myself during college, or for college otherwise. And I was able to get quite a bit of financial aid. So certainly talk to if you have counselors at your high schools or in your college. There's often websites too that you can apply for that list different scholarships and that are available. Like some are local, other ones are more like nation scholarships. And then the government also, there's like, you know, merit-based scholarships and like income-based. So they also have grants available if you have like a certain GPA and your family's income, you know, is below a certain level. Like those are also opportunities available. So definitely look into all of those things.
And me personally, in college, I think that there was like at my college, there's like a health science for students interested in medicine program that you could join. And I think I joined it. There's also the SNMA, Student National Medical Association, which I was in med school, but they also had a chapter for undergrads, which California has to have it because it's such a big state. And so I would just say, look, once you get to college, there's so many different interest groups out there. You really just have to look to see what your college that you end up with offers and sees what interests you and what you want to pursue. And even if you go to a couple of meetings and you don't find it to be like, that's not your thing, don't go back, just go to other meetings and find the interest group that you really like that speaks to you, because there's so many. I think the first week at least of college, I mean with COVID, it might actually be easier because you might not have to go seek them out as much, and they might be seeking you rather than you trying to figure out where they are. They might just have a catalog and say, this is all that's out there, what are you interested in? Because that was the hardest part for me, was finding them and seeking them. I actually didn't know about scholarships. I didn't actually know how to apply for scholarships because, again, I'm the first in my family to go to college, and I didn't know how you got scholarships, and my parents couldn't really tell me how to get scholarships, and my school counselors weren't really very helpful with any of that at my school. So I think, one, I say props up to you all because you're already doing this and getting like awesome advice. from people. So that's great. But yeah, apply to all the scholarships that you can apply, because there's so many out there. And when you do apply, people were getting money for things that I was like, really? You got money for that? Okay. Well, I wish I knew. I did do like financial aid, and our state at the time just had like, if you had a certain GPA, you got like a lottery scholarship just automatically. So I also did that, but that's probably an opportunity that I missed out on that I could have benefited from. And if you do have, because I have heard stories of people say they've gone to their counselors in high school and their counselors have said like, well, I don't think that college is for you, or this scholarship is not for you. Say, okay, thank you. Can you just give it to me and I'll work on it on my own. Thank you very much. Because I've had a lot of my close friends go through that while they were applying, and they're doing great things now, and just say, okay, thanks for your opinion. Now I would still like the paperwork. So
Thank you.
I also,
Go ahead.
oh, I'm sorry, I didn't talk about scholarships. I kind of forgot about that, but I also did a similar thing where I applied for Pell Grants and things like that, where like you don't have to pay back the government. My mom was actually the first college student in her family, so she was actually very helpful. But my partner is a teacher, so I would say all of your teachers have been to college. So I'm sure that even if you're, if you don't like one of your counselors or they're not helpful, like there are more options that you could probably talk to a teacher you really like. Like just be open-minded to looking for more help if this is a big concern of yours, because finances are really stressful. And if you're gonna, I don't want that to be a deterrent from going to getting an education, because there is a lot of help out there.
Yeah, thank you all for sharing that. Angela Echeverry actually put a few links in the chat if any of y'all are interested in undergraduate professional associations. I will also encourage students, I know that I'm not on the panel, but I've had experience of going to Diablo Valley College, Contra Costa College, and also coming from UC Santa Cruz. For most of these schools, there will be an association that exists to help support and connect you with other health interested people. And I would also say, don't be afraid to start your own organization. I ended up starting that organization when I was in college because I felt like there wasn't enough people connecting on a certain subject. So don't be afraid to do that, as long as you meet one other person who has a similar interest. Really assert yourself and make it happen. Kind of like what Fatuma was saying. If people aren't necessarily giving you what you need, sometimes you have to demand it, right? So really finding other people to help you in making it happen is important. And then I would also say with financial services, definitely do some research, some applications, because I'm also applying for nursing school right now. I found that some schools, their programs will have different scholarships that you can actually apply for that are separate from the actual school that you're applying for. It sounds confusing. It is to me as well right now too. So do as much research and attend orientations if schools are offering them, whether they be virtual or in person, because they'll actually give you a lot of that information on financial background in going to their school, and give you extra resources that you might have never even found out about online. Because as you know, there's so many different links that you can click on, and you never know where they're going to take you, right? So with the time that we have left, I did want to ask a question about imposter syndrome. So for those of you who don't know what imposter syndrome is, I don't know if everybody on this panel has experienced it, but it's essentially not feeling like you are fit for a job, or doubting yourself and your accomplishments, or either feeling very overwhelmed by your responsibilities. So I wanted to ask the panel, how do you all deal with imposter syndrome? And if you've ever, experienced it throughout your career and academic journey, what was that like dealing with it?
I remember each time when I was in college, whatever program I was in, coming to the end of my studies and going, oh my God, I have to be an adult now, and kind of freaking out momentarily. But try to remind yourself of the things that you have to offer, that you are worth, that you are worthy, that you are committed. and take a deep breath. I got to where I would just, take a deep breath and say, this is going to pass. It's going to be kind of freaky for the first 6 months out of school, but it's okay. Find your group to network with and hang in there.
I feel imposter syndrome all the time. I remember the first few times that people like came to my clinic to see Dr. Boulos. It was a very weird experience. I mean, I passed all the tests. I went through all of medical school, but it was still very shocking that they were coming into an office to ask me for my advice. It's gotten a little bit more normal, I guess. But it's just, it kind of shocks you at moments, the things that you're expected to know. And I feel it all the time that like, I can't believe people are here to have me do this treatment and things like that. But usually Cindy was saying, you usually walk through it. Everything turns out fine. But in the moment, you get these moments where you're like, I can't believe I'm in charge of this big decision or this big life-changing treatment or this and that. So yeah, it happens. Even though I've been on this journey of training for years and years, it happens all the time.
Imposter syndrome is real. Like Anna said, I still experience it during residency. And I think times when it was most challenging was when I was applying for medical school, when I was thinking, oh my God, how am I like this person who just, nobody in my family like has any background in medicine. I'm like the first one in my family to go to college, all these things. How can I compete with somebody, whose parents are doctors and like all this stuff, and they've been in the college track their whole life. And yeah, it can feel really overwhelming. And I think what was helpful for me was relying on my friends and family for support, and also just reflecting on like the struggles my own parents had, and them moving here from Peru and having multiple jobs while raising me and my sister. Like my mom, for example, she when we first arrived, she was working first as a babysitter, and then she was cleaning houses during the day, and then in the evening she would go to night school to learn English, so that she could get an office job later on. And then that's what she's doing now. Like she works for this accounting department. So just having that in the back of my mind of like, okay, my parents, struggled so much to get to where they are. Compared to all of that, I think if they can achieve that, I have, much more resources available to me. Like this doesn't seem so bad. Like my job is to work hard and study hard so that I can also provide for myself and my family later on. And then and like I was saying earlier too, having a really strong friend support group that will help uplift you and can be a sounding board for when you need advice for things. And then I think the last thing I just wanted to say, there was a point where I actually created a little list for myself, like listing my own accomplishments and like the things that I had been able to get done. And then I would kind of look at that and reflect every once in a while to kind of prove to myself, like, look, these are all of the things you've been able to get through that you've accomplished. Like, you've gotten this far, you can certainly keep going. I haven't looked at that in a while, but I probably should.
Yeah, I feel like a fraud all the time, or like I don't belong, or I'm in the wrong place, all the time still. And I think that I think it has to do with just, again, just not seeing people who look like you ever doing what you're doing. So I think that's one of the reasons why I just am like, do I really belong here? And then sometimes I think that it's really just my own self-doubt of myself, like just being really critical of myself and hard on myself. And if I don't know something, not realizing that, okay, it's a learning opportunity, but feeling like I should already know it. And because I don't know it means that I'm actually not a doctor. And so I never would and I don't really call myself doctor, but I never really like call it or respond to it, or and my sister jokes with me and calls me that all the time, which I say jokes with me. She does it as a joke, but now I'm like, yes, I am. What would you like to talk about? And I think doing that, it's kind of silly, but sometimes I do that Superman pose. I don't know if you've heard of it, where you just kind of stand and or like, I am empowered. So sometimes I do that too when I'm feeling kind of a little down and like, should I really be here? But I think the most important thing is wherever you choose to go or whatever you choose to do, like healthcare wise or not healthcare wise, is if you're doing it because you belong there, and you're doing it because you got yourself there. And so you do deserve to be there, and you are whatever it is you end up doing later on in life. And I think that's what's really important to remember, and that's what I always have to tell myself. It's like, I did take all of those tests. I did sit and pass pass those shelf exams. I did see all those patients, and I did apply to those schools, and they did pick me, and I do belong here. And now they get what they get, but you do belong there. So, and I mean, you say they get what they get, but they chose you too. So you chose them, they chose you. And you're supposed to be there. And that's what I sometimes have to remind myself about, because I do sometimes feel like, oh, I don't, but you do.
A good thing to remember too is that you don't have to know everything, every bit of information in the universe, but you have to know where to find it. And if somebody asks you a question, you don't know the answer, just say, I don't know that right off the top of my head, but let me go look it up. They're not going to fault you for that at all. That's perfectly normal.
All right, so that concludes our time together. Thank you all so much, Cindy, Anna, Fatuma, and Sylvia, for sharing all of your experiences in the healthcare system, and investing and spending this time with the folks who have showed up today and will watch this recording in the future. But yes, thank you again for sharing so much. And I think that was a really great note to leave on, because it's really easy to doubt ourselves when maybe we don't see other people that look like us, or if we're coming from a specific background that had to deal with struggle, right? But remember, y'all are enough. So thank you again for being here and sharing all of that wisdom, because even as a young person, like I'm feeling that way too. So it's nice to hear from people who are older than me that I can look up to, who are in those professions, that they're dealing with it too, but finding ways to process and move forward with it. So that's it. Thank you so much, everyone.